Neylisha. Neylisha. Neymuchi.
Should we go outside?
Clap your hands. Okay, now faster. You're doing great.
Perfect. Okay. Are you going to school?
Our mother taught us that nothing is worth doing if it doesn't help others. That guiding light helped us to become surgeons, and when I retired in 2008, my lifelong desire to work in Africa was made possible and brought me to Ethiopia. There, my experience as a surgeon enabled me to see opportunities to help families and mothers and children, and of course our fellow physicians. From the beginning, for us, it was all about the babies, and the best way to help them was to focus on training Ethiopian neurosurgeons, surgery for Ethiopians by Ethiopians. In both meetings, we want to talk about who is going where after they graduate, so that we can make a plan for how the campaign is evolving and how we are going to spread out around the country. We started ReachAnother Foundation in 2009 and began an amazing and humbling journey that includes training neurosurgeons, a committed partnership and collaboration with the Ethiopian Ministry of Health, and the establishment of neurosurgical centers of excellence in 6 universities across the country. We saw surgical milestone after milestone, the development of critical aftercare training, and nursing services to equip communities to help their children heal and lead a full life.
She wants to be doctor.
Today, skilled neurosurgeons have completed more than 7,500 life-changing operations. New aftercare resources are helping care for 2,000 newborn children annually. More than 50 neurosurgeons are saving countless lives, and in the process we've secured equipment and supplies worth more than $1 million. Because our medical school teachers hammered into us that chance favors the prepared mind, the bedrock principle of ReachAnother is to always look for opportunities to help. So when in 2018 the chance to help deliver a prevention solution for neural tube defects in Ethiopia suddenly presented itself, we did not hesitate. That year we learned that 44,000 pregnancies were lost every year because of spina-bifida.
Can I ask them if they know about the use of folic acid during the pregnancy?
Okay, during pregnancy. She doesn't know.
We know that spina bifida is caused by a lack of folic acid in the mother's diet, but the birth defect occurs before the mother knows that she's pregnant. Therefore, the only scalable and sustainable solution is to ensure that folic acid is part of the Ethiopian diet. We found that the only food that all Ethiopians eat is salt, and that salt is already fortified with iodine. We also found that adding folic acid to the salt is very easy and cheap. ReachAnother provided the seed money to make this happen. We are the catalyst that brought together the Center of Spina Bifida, Nutrition International, the Gates Foundation, and many others. While our mission has grown, our ability to visualize what was once unimaginable is now undeniable. We are now working with the Ethiopian government to make the changes we helped pioneer an integral part of the hospital system and funded by the government. Our nurse specialist teams will set the standard for the entire country. We are advocating for all children with SBH to get free care. Our experts at the Center of Spina Bifida predict that once salt is fortified, Ethiopia will see a reduction of spina bifida by 90%. We can now see the end to the huge epidemic in Ethiopia and predict that in a few years the vast majority of these children will be born healthy. And as a happy side effect, more than 40 neurosurgeons can turn their attention to other conditions like brain tumors and epilepsy. With Ethiopia leading the way, the end of this worldwide scourge is within reach. 12 years ago, ReachAnother could never have predicted what being prepared and willing to lend a helping hand would achieve. Your generous support is our foundation. And with your continued willingness to give, we will continue to live the teaching of our mother and give help because it is worth doing.